25% of the adult population in Israel currently lives with a severe liver condition, even though many have never consumed alcohol. This is non-alcoholic fatty liver disease, or NAFLD. It is defined by the physical accumulation of fat cells inside the liver tissue, a process that can occur entirely independent of alcohol use. The disease is progressive. It begins as simple fat storage, but can advance to NASH, where the liver becomes inflamed. This leads to fibrosis, the formation of scar tissue, and eventually cirrhosis, where the damage becomes permanent. In these early, reversible stages, NAFLD typically produces no physical symptoms. It is frequently discovered by chance during routine abdominal ultrasounds, rather than through any felt pain or discomfort. 1 in 4 adults is currently living with a metabolic condition that slowly impairs their primary filtration system without their knowledge. While the disease is characterized by fat accumulation, simply reducing dietary fat does not address the underlying biological cause of the buildup. This schematic illustrates de novo lipogenesis. When the body receives excess carbohydrates, the liver chemically converts those particles into new fat molecules. When this internal fat production outpaces the liver's ability to export it, fat molecules become trapped, stockpiling within the organ structure. Because reversing this process requires a significant metabolic shift, anyone with liver disease or diabetes must consult a doctor or dietitian before making dietary changes. High carbohydrate intake drives the liver to manufacture its own internal fat stores, which is the primary driver of this condition. The intervention involves restricting carbohydrates to a ketogenic level, typically below 20 to 30 grams per day. A 2020 study published in the Journal of Hepatology found that just 6 weeks of a ketogenic diet resulted in a 31% reduction in liver fat. This works through 2 specific mechanisms. First, the liver stops producing new fat from carbohydrates. Second, it enters a state called beta oxidation, where it begins to burn its own stored fat for energy. This shift also lowers insulin levels, which prevents further fat deposition. Simultaneously, the liver produces BHB ketones, which provide a targeted anti-inflammatory effect for the liver tissue. By removing the carbohydrate supply, the liver shifts from a state of fat storage to a state of active fat consumption. Successful liver recovery also depends on the presence of choline, a nutrient essential for the export of fat. The liver uses choline to package fat into transportable units. Without it, the liver cannot move fat out of its cells and into the bloodstream for use by the rest of the body. To maintain these levels on a ketogenic diet, the primary sources are egg yolks, quality beef liver, and fatty fish like salmon. Without a sufficient daily supply of choline, fat remains trapped in the liver, even if the body is in a fat-burning state. Successfully implementing these nutritional requirements involves choosing specific fats, such as extra virgin olive oil, while avoiding the processed seed oils that can further stress the liver. Tools like ketomap.co.il provide the data needed to identify liver-supporting ingredients and distinguish them from processed foods that hinder recovery. Ketomap functions as a guide for this metabolic transition, ensuring that daily food choices align with the clinical requirements for liver health. Clinical results are often visible within 4 to 8 weeks. During this window, blood tests typically show a significant decrease in liver enzymes, specifically ALT, AST, and GGT, indicating reduced cellular damage. These internal changes are usually accompanied by a measurable reduction in waist circumference, weight loss, and improved triglyceride levels. Ongoing recovery requires medical tracking. Physicians use periodic blood work and ultrasound imaging to confirm that the liver fat is clearing and the tissue is healthy. Use the resources at ketomap.co.il alongside professional medical oversight to implement these dietary changes safely and effectively. When provided with the correct nutrient profile and a reduction in carbohydrate stress, the liver is capable of reversing fat accumulation and returning to normal metabolic function.